Being on the surgical service, like I said, the mentality is a little bit different in general, but I myself don't consider myself, above anyone because I've been doing surgery for 2 weeks. I don't have any experience. My last day on medicine, I was taking care of a patient, and I thought he was going to be discharged, but he ended up staying in the hospital. My first day on surgery, I had to go see him as a surgical consult for a question of some surgical issue. And so I returned to him. He recognized me. I said, "Hello, I'm now the surgeon." And I thought that was hilarious in my mind. So basically, my role as the resident is to meet the patient in the pre-op area, find out a little bit of the history, what surgery they're having, why they're having it, introduce myself. And then, the pre-op nurses and anesthesia do their thing, and I wait for them to get wheeled into the operating room. And basically, I'm like the surgeon's assistant. So, I scrub with the surgeon, and then really it's kind of up to the surgeon as to what I do. Mostly just, holding things in place, having an extra hand or two, making her job or his job easier. And, if they are comfortable with my skills, then, they'll let me suture some things and, cut some things sometimes. Probably thinking that it would be an emotional experience for me, but it's not really anymore because I've done it so many times. So it's just another gallbladder taken out. It's very common. I did 2 appendix. What's the plural of appendix? Appendices. 2 of those this morning before breakfast. They were emergencies from overnight. So I guess today, this is the 3rd of the day. We're going to do it laparoscopically with the cameras, so you'll actually have a better view because you can just watch it on TV. You sit back and relax. No popcorn, though. The patient was draped sterilely.
Can they record our time? Everyone agree? Everyone disagree? All right.
We made an incision at the belly button and dissected down into the peritoneum, which is the abdominal cavity, and stuck the first trocar in, which is for the camera. And so then we inflate the belly with carbon dioxide, so you can actually see inside. And so then the camera's in, you kind of look around, get oriented, and then you make a couple more incisions and stick other trocars in for the instruments, so the forceps and the scissors. And so basically, there are like maybe 4 trocars in the belly, but the surgeon only has 2 hands, so it helps to have 2 extra hands. I was holding the camera and holding things in place while the surgeon was actually dissecting the gallbladder away from the liver, identifying the cystic duct and the artery, and making sure, she didn't cut any important structures that she wasn't supposed to cut. The gallbladder is connected to the bile tree with just 1 tube, and then you clip it, cut it, peel it off the liver. You stick a bag in the abdomen, put it in the bag, pull it out, and you're done. It's pretty straightforward, and then you just sew up the little holes in the belly, and the patient typically does fine. Usually can go home the same day. Just manipulating the camera takes a lot of practice. Never mind manipulating the actual tools, which I haven't really had much experience doing. But I can imagine that it's a lot more difficult than, say, cut a nice piece of abdomen open and just go in with your hands, because you're basically using tools on foot-long sticks. So, yeah, it definitely takes a lot of dexterity, I would say.